Hi, Dr. Ariane from the Movement Paradigm. Are you wondering what you should expect from physical therapy, or maybe what you should not expect? Well, we're going to talk today about not only what you should expect from physical therapy, but what you deserve in physical therapy. So as a physical therapist for the past 12 years, and as a movement specialist for the past 24 years, I can assure you that there is definitely certain things that you should expect from physical therapy. Number one is no matter what you are reaching out to physical therapists for, whether that's balance issues, movement issues, chronic pain, acute pain, vestibular balance issues, you deserve a thorough evaluation. So that means not only a physical therapist should be looking at your current symptom, but they are looking to figure out why that happened in the first place. So that means a thorough evaluation includes looking at, of course, detailed movement assessment, looking at where your compensation patterns lie, what might be driving some of the issues that you have, and looking at all of your modifiable lifestyle factors. How is your sleep? How is your nutrition? How are your relationships? How is your stress management? Because if you are missing these things, then you're missing a huge element of actually healing your own body. Number two is you deserve a physical therapist that is practicing what they preach. Whether that's movement or balance or exercise, they should really be a health leader, a movement specialist, a health educator. And so because of that, they have an obligation and a duty to be able to do the things that they are saying you should do, that they're suggesting. So make sure that you find a therapist that actually does that. Number three is one-on-one care. So yes, it is hard to find in this day and age for sure. I've worked in outpatient practice for 8 years, and so I understand a busy outpatient practice, and unfortunately the demands of insurance are creating that environment. However, you deserve to be able to be the only person in the room, to be able to be listened to really have your therapist be able to understand what's happening, what your current concerns are, what your goals are, and where you want to go. So one-on-one care is extremely important. So whether that's 30-minute sessions or 60-minute sessions, but to be able to have that one-on-one attention is vital. Number four is someone that is going to look at you as a whole person, someone that is looking at you and your story and listening to your story to be able to understand that you are not a shoulder problem, you are not a hip injury, that you are a person, you are human with a story and emotions and thoughts and all of the things that make you you and make you wonderful. So make sure that someone is looking at you as a human and as a person and not simply just an injury. Number five is a therapist that will help you perform mindful, intentional movement to help guide you to move with interoception, so that internal awareness of self, to be able to understand movement and movement quality as opposed to sets and reps and lots of volume. As movement educators, that is truly one of the greatest gifts that we can help you with, is to be able to move your body the way that it was intended to, so that you can do the things that you love. All right, so what are some of the things that you should not expect from physical therapy? This is equally as important. So number one is you should not be on hot packs, cold packs, electrical stim, ultrasound, lots of modalities that aren't really helping you get well. They are sometimes time savers, but they are not actually creating better movement in your body. They're not getting to the root of your issue. They are not moving you forward in any direction. And so you want to be able to use all of your time in physical therapy to get better. Number two, you don't want to get to physical therapy and go on the treadmill or the bike or whatever it might be to warm up for 10 or 15 minutes. You want to start and learn how to move your body right away. How can you use the floor and the wall and integrate into normal movement as opposed to, again, just spending a little bit of extra time and getting on a machine to warm up. Number three, you should not be going through tons and tons of band exercises with really poor form and no one's watching you and you're just going through the motions feeling like you could do this at home. If you feel like you could do that at home, that's your first sign that this is not a good fit. And I want everyone to believe in physical therapy, and the opportunity that we have to share with you is, again, that gift of movement. So if you're feeling like you're going to physical therapy, this is a waste of time, you're put on machines, you're using all these modalities, then that is not the experience that you deserve. So please make sure to find a great physical therapist in your area that does one-on-one care, that looks you with the whole person, that really is looking at all of the different potential root causes of your injury or your pain or any other issue that you might be experiencing. And if you need help, please reach out to us. We do virtual care as well as in person, and we perform holistic physical therapy as we practice functional medicine. So we're always really trying to make sure we're helping you address any underlying issues. So if it was helpful, give it a like, give it a share, and make sure to subscribe to our YouTube channel, The Movement Paradigm, for weekly tips on mindset, nutrition, and movement.